So let's talk about how baby is going to be rotating through the pelvis and how it could relate to a shoulder dystocia or where the shoulder gets caught in the pelvis after baby's head has been born. So first, baby wants to align with the pelvic level. So you can see this pelvis is widest side to side and baby's head is widest front to back. So baby wants to enter into the pelvis sideways. After that, they're going to internally rotate, so they're going to get diagonal, so back of the head is right here, to rotate through the mid-pelvis, which is widest diagonally. They're going to continue that rotation so the back of their head is towards the front of the pelvis, and so they line up to the pelvis vertically. After that, this is the front of the pelvis. Baby is then going to extend underneath this pubic arch so that their head has now crowned and been born. And at this point, the shoulders should follow. So the shoulder are widest side to side. So they're going to enter into that top portion of the pelvis or the inlet. After that, baby's going to begin to rotate back in the direction they were. So now the shoulders are moving diagonally through that mid-pelvis. And then they're going to line up so that they're facing sideways. So the shoulders are now vertical, so now they can be born. But what happens with the shoulder dystocia is after a baby's head has crown, they rotate too early, which causes the shoulder to get caught. The other thing that can cause that shoulder to get caught is if baby has broader shoulders, which sometimes can happen with gestational diabetes, where it's being managed by insulin, or if baby is just on the large side, their shoulders can also get caught because of that. The other thing that could influence this is a lack of movement. So sometimes an epidural can increase your risk, but not significantly. Shoulder dystocia is on the rare side, but it is a birth emergency. So baby's head has rotated, but the shoulders did not clear the inlet, and now it's caught in the inlet. So what should you do? First, it's really important to recognize that this is a birth emergency. So whatever the provider and the staff is trying to encourage you to do, it would be highly recommended to do that. Likely the movements that you can expect to see is going to be like a butterfly pose, which is going to be a lot of external rotation, really trying to open this inlet space. So really wide knees, probably grabbing onto your feet. So what it'll look like is you'll probably be put onto your back, and then you'll be encouraged to grab onto your feet. So I'm in that butterfly pose, and then pull them to yourself. So this is bringing you to a really exterior rotation of the femurs, which is going to help open that inlet space. And then maybe lifting up so that you get a little bit more of that posterior pelvic tilt is going to help open that space more front to back as well. After baby's shoulders have entered the inlet, then we're going to move on to the next move potentially, unless baby is born in this position. The next level that baby's going to rotate through, if they aren't born pretty much immediately after opening up the inlet, is going to be the mid-pelvis. So now they're going to descend and rotate through the bony structure of the pelvis. So first we want to open the top portion of the mid-pelvis, which is going to involve an anterior rotation of this side of the pelvis, which is going to involve abduction and then also external rotation. So this is going to be opening it more on this one side to allow those shoulders to begin its rotation. After that, we then want to posteriorly tilt that half of the pelvis. So now baby is trying to enter into this space, which is going to move that sacrum to the side so baby can finish the rotation. So we have our posterior pelvic tilt, adduction here, and then also internal rotation, which is allowing the sacrum to shift and create more space in the bottom of the pelvis. So what those moves will look like will be a half kneeling lunge most likely. So you'll bring 1 foot forward, likely the left side if that's the side baby is on. First, we want to open the top port of that mid-pelvis. So we want to wide stance and trying to push that knee out. You can either push it out or you can just be on one hand as you press. So from the side, it looks like this. After baby has begun the rotation, then we want to start to focus on opening the posterior outlet or the bottom portion of that mid-pelvis. So now instead of this really wide stance, we want to first drive this hip crease back, allow that knee to come in, and then we can even press into the arm either with the hand or with the upper arm so we have more of that adduction happening to help open the bottom portion of the pelvis so baby can finish that rotation. So what that looks like from the side is I want to drive this hip crease back, let this knee come in, and then press into it. So I have my internal rotation, my adduction, and that posterior pelvic tilt to create more space on the bottom portion of the pelvis. So shoulder dystocia happens when baby's shoulder gets caught in the inlet. It could be because baby's shoulders are really broad. Maybe they begin their rotation too soon, and so the shoulders got caught before entering into the inlet. It's important to note that it is a birth emergency, so you should follow whatever it is that the doctor or the staff is prompting you to do instead of trying to think about the movements that I showed you. But the movements that you could expect to see will be something that's going to open the inlet. So like that butterfly pose is going to help open that inlet more. If baby still has not been born after doing this butterfly pose, you can probably expect to get into some sort of half lunge position. So first trying to get that anterior portion, so shifting this side forward and then shifting this side back to help create more space in the bottom.